Painful ejaculation can lead to problems in marriages, relationship, can lead to low self-esteem, and can also lead to frustration if care is not taken. Good day everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as the Nurse with the Difference, and I make learning easy and accessible for all my students. Like I earlier said, all the videos I made are based on requests from my viewers. So I've been answering the females a lot and I have neglected the male. So today I decided to answer that particular question a male counterpart asked me, and also a female also asked me this particular question. It was like, Nurse Mary, is ejaculation painful? And if yes, what could be the causes of painful ejaculation? Today, I'm going to be sharing with us 9 causes of painful ejaculation. But before we go into details, if you are new on our YouTube channel, please click on the subscribe button, turn on the notification button so you don't miss out. For all my returning subscribers, I am saying thank you. Let's go there. Welcome back. Like I earlier said, today I'm going to be talking about 9 causes of painful ejaculation. Painful ejaculation is also known as dysorgasmia or orgasmegia. Dysorgasmia or orgasmegia. I don't know if I'm pronouncing it correctly, but you can see the spelling on the screen. So this is another term for painful ejaculation. Like I earlier said in the previous video before this, ejaculation ought not to be painful. It should be pleasurable. But when it becomes painful, it is something you will have to see the doctor about. And this pain can be around the penis, the scrotum, and the perineal area. So this video, I'm going to be sharing with us the causes of painful ejaculation. What are the 9 causes of painful ejaculation? The first one I'm going to be sharing with you is known as prostatitis. Prostatitis. And prostatitis is the inflammation of the prostrate gland. We all know that the prostrate gland is found only in the males. You can see the screen on the board. It is found only in the males and it is not found in the female. So if you're a female and you have a prostrate gland, it could be you are a hermaphrodite, like male and female together, but generally prostrate gland is found in male. So an inflammation of this prostrate gland, which is known as prostatitis, can lead to what? Can lead to painful ejaculation. Then that takes us to the second causes. The second cause of painful ejaculation is sexually transmitted infection. Yes, sexually transmitted infection such as trichomoniasis can cause painful ejaculation. So that is why I am advising generally, when as a man you are experiencing painful ejaculation, it is important you see a doctor so it can be rectified. So a series of tests can be done to know what is happening. Then the third cause of ejaculation pain is medical procedure. Some medical procedures, some surgeries can result in ejaculation pain, and some of these surgeries include your radical prostatectomy, which is the removal of the prostrate gland. Remember, I told you the prostrate gland is only found in the male. So the removal of the prostrate gland from the male as a result of cancer or one or two things in the body can result in painful ejaculation. Do we get that? The first one I said was what? Prostatitis, which is the inflammation of the prostrate gland. The second one I made mention of is what? Sexually transmitted infection, which I just said, for example, your trichomoniasis. Then the third one I made mention of is what? The third one I made mention of was medical procedure, such as radical prostatectomy and herniorrhaphy, such as such as an operation done for hernia. So these TB can cause what? Painful ejaculation. So then that takes us to the 4th causes of painful ejaculation. Fourth cause of painful ejaculation could be medications. Some medications we take, some antidepressant medications, such as your selective serotonin reuptake inhibitors, also your serotonin and non-epinephrine reuptake inhibitors, your tricyclics and tetracyclics. All these can lead to painful ejaculation. This is something you have to look into. All those energizer you take, they can cause that. Those antidepressants you take, they can cause that. Then the fifth causes of painful ejaculation is cysts or stones. Cysts or stones in the ejaculatory duct. You see that ejaculatory duct, as the name implies, sperm passes through it. Ejaculatory duct, where the sperm passes through. So when there is formation of cysts or stones around that ejaculatory duct, it can result in painful ejaculations. Do we get it now? So I've listed 5 causes of what? Painful ejaculation. Then that takes us to the 6th cause of painful ejaculation. Then number 6 cause of painful ejaculation is pudendal neuropathy. Pudendal neuropathy, when there's damage to the nerves in the pelvis area, the pudendal nerves, there's damage to this nerve. So when there's damage to this nerve, it can result to pain around that pelvis and genital areas. So things that can predispose one to have this damaged pudendal nerve, for example, your diabetes and multiple sclerosis. So pudendal neuropathy is a cause of painful ejaculation. That is what number 6. Then number 7 point is prostrate cancer. Cancer of the prostrate. You can see most of the things I'm measuring are talking about the prostrate gland. When that cancer, when there's cancer, you know, cancer is a malignant. When there's cancer of the prostrate gland, it can lead to ejaculation pain. That's the number 7 point, cancer of the prostrate gland. Then that takes us to the number 8 point, which is radiation therapy. Any radiation therapy that is done around the pelvic region, the pelvic area, can lead to painful ejaculation. Can lead to what? Painful ejaculation. Then the last point I have to share with us, which is the number 1 point, in 9 points, it's psychological problem, mental issues problem. There are some people, when they masturbate, they don't feel pain during ejaculation. But when they're not having sex with their partners, they start feeling pains during ejaculation. So these might be psychological, and this person might need a therapist. You get? And some other psychological issues that can come up is low self-esteem. Like I will always tell ladies and also men, when you have low self-esteem about yourself, you don't appreciate yourself, there's going to be a problem with your sex life, and that can also result in ejaculation pain. Hope we get this 9 points I just shared with us on what causes ejaculation pain. So for the men that keep saying ejaculation is painful, it's not something you should take as little. It is something you should call upon your doctor. It's something you should see your general doctor or your general practitioner that takes care of you people, so they know, they check you, they test you, and know what is happening with you. During the process of checking and testing you, a lot of history has to be taken. When did this start? Are you having frequent micturition? Are you going to the toilet frequently? Is there blood in the urine? A lot of questions will be asked to be able to make a definite diagnosis of what is wrong with you. If you know you are having a painful ejaculation, don't just keep it to yourself. See a doctor and find out. It is better for you to see a doctor and the doctor tell you are fine than for you to assume you are fine and something is wrong. So that is just my advice. You can see there are a lot of causes of painful ejaculation. So don't compare painful ejaculation with menstrual pain. You get? Menstrual pain is something serious. Painful ejaculation is something serious. But normal ejaculation is pleasurable and it ought not to be painful. Thank you very much for watching my video. Thank you very much for staying tuned. Don't forget to like, don't forget to subscribe, and don't forget to share with a friend if you got value. For all my returning subscribers, this is me saying thank you. Bye. I wanted to say let's go there, but this time it's bye. See you in our next video. Bye. Wow.